For our patients that come in, and we see a number of them that are clenching or grinding, that's a very uncomfortable situation. So with teeth and grinding, the philosophy was that if I put in a bite guard, now if you think and listen to the word bite guard, what that does is not necessarily treat your clenching or grinding, but it guards your teeth. And so what we found, actually, some research and studies done by a dentist in California who is actually developed, Jim Boyd developed this NTI system, or device, I guess would be a better term for it. Now, the difference between an NTI and a bite guard, or bite block, or if you want to use that term, is the bite block goes over all of your teeth, usually the upper arch, and has a flat surface for your bottom teeth to slide around and fit against. The problem with that is it actually potentiates and increases, Dr. Boyd found out, the amount of stress or ability to actually clench. You can actually increase these muscles' ability. It's like the difference of your arm being straight out and you try to lift it, compared to you bend it a little bit, and wow, you can really lift or stretch with it. So TMJ's philosophy changed. So the NTI, and the term is, it's a mnemonic, is Neuro Transmitter Inhibitor, NTI. Very simple, actually. And the way you can check it yourself is take a pencil, put it in your mouth, and bite it this way with it. And when you do, you can probably break the pencil if you plunge down. Take that same pencil, put it between your two front teeth, and try to bite down on it. And all of a sudden you'll, oh, I can't bite. Why? Well, you can't because these neurotransmitters from your teeth to the root tips of your teeth, when you hit your two front teeth together, it sends a message, a reverse message, so to speak, to these muscles and nerves in your jaw joint. So what you end up doing is not clenching when you hit your two front teeth together. A little side story, I had a dental assistant, never had an alarm clock her whole life. She always was on time. She said she never slept much at night. She was up every 2 or 3 hours, and not like sometimes us males of an older age sometimes have to get up during the night, but she was just getting up because she was a restless sleeper. We made an NTI for her because she wasn't really complaining that she was having jaw joints or anything. She says, I sleep at night, but I constantly am getting up, and I don't know really why. Guess what she had to do the next morning after she wore her NTI for a few days? Buy an alarm clock. Because she was almost late for work for the first time that she was a wonderful assistant, always showed up. But this one morning she came in and she was all frazzled and running around. I said, what's wrong? She said, I fell asleep and I slept so sound, I didn't get up like I always do. So I guess I better buy an alarm clock. So the NTI does work.